Hey y'all, we're back with another Messy Monday. So welcome to Messy Mondays, where healthcare admin gets real, one mess at a time. I'm Brittany,
I'm Satasha.
and we are BCN Billing and Credentialing Network.
We are your billing baddies.
Yes. And we're gonna jump right into it. This is a follow-up from last week's Messy Monday. We were talking about AI, and we're just
Mhm.
gonna follow up with some more information because it's a good topic and we got a lot to say about it. So let's get into it.
Okay.
So AI and medical bill. So we're gonna talk about the automation, the AI, and just reality for practice owners that might want to go that direction. And our goal is to just kind of educate you all on what automation and AI can realistically do and prevent costly misconceptions because y'all be doing that.
Yes, indeed. Okay. Okay. So AI is being marketed as a way to eliminate us, the billers, the billing headache, and reduce cost across the board. However, the bigger risk isn't underusing the automation, it's that you're too trusting of the automation. Okay? That's just what it is. You're too trusting. Don't trust it so much. So basically what that means is you see a lot of companies coming in saying, "Hey, we got AI. It'll come in, do your billing, and this, that, and the third." Who's gonna call it? Who's gonna make the phone calls when claims deny? AI can't do that. Who is going to double check or oversight of billing if you're only using AI for billing? Nobody. So what if it's not built for Pacific. Listen to me, not the ocean, specific states. State insurance is where you have to have a modifier when you have supervisees and supervisor situations going on, or you have to use the UD modifier when you're billing Medicaid MCOs in certain states, or when you need a 25 or the 59 modifier. What if you're doing physician billing and your claim is over $100,000? How is AI going to know to go in and how is AI going to know to go in and put the 76 modifier and do claim of so many to break it up the way it's supposed to be? So those are some things that we have to think about when we're thinking about let's just use AI totally to take over our billing department. Um, so that's one of the biggest reasons that it's exploding in the medical bill because of the rising staffing costs, because of the billing and credentialer shortages. It's not no shortage over here, but just putting that out there. Increased payer rules, and using AI, you can put the payer rules inside of that, and vendors promising a full automated billing system.
It's never.
Never.
If they tell you that, don't believe them.
It is
Don't
not
believe
true.
them.
So it's being sold as a solution to complexity, but the complexity does need human oversight.
Okay, so we're not just gonna put AI down and the automation and stuff like that. Again, because we're not discouraging you guys from telling you don't use it. We are telling you, yes, it's okay to use it. However, um, we're gonna tell you what AI and automation actually can handle well. So like eligibility verification, claim scrubbing and edits, payment posting, simple denial categorization, and credentialing document tracking. Those things, oh yes, use AI. Hey, yes, use it. We are for it. Yes,
What the young people say, clock that.
definitely. So, it does use those things well, and we see it firsthand for clients that decide they're a EHR, even though we do their billing, it is integrated into their systems, and we utilize it for certain things too when we're doing your billing. But again, we're the oversight. Hey, that's us. It kind of goes hand in hand. You can't just have that whole automated process. I promise you, um, it won't work. You might think it's working, but then you're gonna look up and be like, "What? I got $90,000 worth of unpaid stuff, and you don't know why because you ain't got no human kind of tracking that and overseeing stuff like that." So
Exactly.
the key point is automation improves speed and consistency, but not judgment.
Yes, yes, yes. So with that being said, what it can't replace, because like she said, it improves speed and consistency. You feel me? It does. It makes stuff so much better in certain areas. But what it can't replace is interpreting payer behavior. It cannot do your appeals, and it cannot decide if an underpayment is accurate or not, and it can't do the recovery. It cannot respond to audits that you may get in the mail. It cannot resolve your credentialing problems, and it does not make perfect compliance decision making. So whatever you tell it to do is what it's going to do, but it's never going to use its best judgment because it's ran by rules. It's not ran by I have multiple choice. This is what I should do type situation. It's not going to be like that. So, and the reality is, owners, you still need somebody in office to make those judgments, to look at the context, and to negotiate with the payers. That is still human interaction that's going to be needed.
Definitely. So we're just going to talk about some of the myths that we've seen some practice owners like they actually believe this stuff. Well, okay. So I've heard, oh, automation eliminates billing errors. If that's what you think, if that's what you believe,
Not
that's not true.
eliminating, it's reducing.
That's it.
Play
There's a
on words.
difference.
The
There's a difference.
difference. Eliminate.
All
What's
right.
another big myth you got?
Another myth is AI keeps us audit safe. It does not. It does not. It does not.
It's not. I mean, it's safer, but it don't prevent audits. If you refer back to our last video, we talked about like it's only going to put in what you wanted to put in or what it thinks is relevant to what needs to be put in. So if you're not double checking, if you're not having that human interaction, reading your notes and your documentations that is creating for you, it could definitely cause audits, especially if it's repetitive information because all your patients don't have the same diagnosis. All your patients don't have the same, resolve that's happening in their household. So if your AI is saying, oh, they got a pet named Randy, got a pet named Randy, got a pet named Randy, you got 15 people with a pet named Randy, the insurance gonna say somebody lying.
Yes. Okay. Another myth. Oh, this one drives me crazy. And I get it. You want to cut costs, you want to save money, you want to make more money. We can downsize staff immediately because we have that's a myth.
It
Because
is.
again, human interaction is important. It is AI is simply a tool used, as Satasha said before. How did you say it, Satasha? A tool to be helpful, but does not replace a person.
It doesn't. It does not. It does not replace a person. You can downsize eventually, and I'm pretty sure eventually it's going to get to a point where AI can do all these things. But it's gonna be a partnership between AI and human. It's not going to be AI doing everything. Now, AI can do a lot, but AI is not going to be able to do everything. I know they're building systems now so for AI to go in and do the automated system through the phone calls to get claim status information. Yeah, and so they're going to be able to do that versus talking to somebody. They can go through the automated system, get the claim information and put it into the system, which would be helpful. But if it says, like, if you recall Aetna and it says zero payment claim denied, they're not going to give you the reason for
Information.
exactly. They're just going to say zero paid, zero allowed on check number, this is and the third, and that's all the automation is going to be able to do. They're not going to be able to appeal or look at the reasoning through the automation system. So yeah, you can downsize, but not immediately. Eventually.
Yes. And the last myth we've heard was, well, credentialing can be fully automated.
I don't know who told
No.
y'all that. I don't know who told y'all that because many times we didn't have to call Carolina Medicare.
Jesus. Again, it can be good for credentialing document tracking, but not
Boom.
doing the applications. So let me run that back, say that one more time. It can be good for the tracking, document tracking, but No, credentialing, I don't even know if that, I mean, eventually maybe they will get to it being fully automated, but right now, I
Mm-mm.
don't think
Like,
so.
because most of the applications you can do online, you can do it online. It can populate some of the information, but I don't know how many times AI done called me Seta Shay, and that's not my name. So we have to look at stuff like that. Okay.
Yes, yes. All right. And then, so with that being said, we're going to close today's Messy Monday and tell y'all automation reduces task, not
Mm.
responsibility.
Ooh, you better say it. You better say it. It reduces task, not responsibility. Now that you know what automation can and can't do, the next question that you should be asking yourself, what does it mean for your billing staff, your overhead, your long-term revenue strategy? And that's what it really breaks down to. That's really breaks down to like what can we use AI for to defer some of the responsibilities of our full-time staff so that they can work on something else. That's how we need to be looking at AI. We don't need to be looking at AI as if it is the one all tell all. I'm gonna be running this practice, me and AI. I don't know if y'all watched the movie where the AI tried to kick the people out the house, but AI gonna be trying to see your patients too. And that's what they're working on. Just to put that out there, providers, they are working on AIs to evaluate your patients. And it can be
That's a
scary. It can be
whole nother topic. That's a whole nother topic.
indeed,
But,
indeed.
but yes, but yes. Yeah. Yeah. That's a whole nother topic.
That's a whole nother topic. All right, y'all. So I think we still have this. That's another topic. We're gonna be talking about next Monday.
Keep it rolling.
Um, keep it rolling. We'll make matter of fact, we'll make January be AI. AI maybe the first part of February. Just maybe. So that wraps up another Messy Monday where we tackle the truth about AI this time. Remember, it's all about improving, learning, and becoming a better provider. It's about learning what's best for your practice and what's best for your patients. If you found this episode helpful, you already know what to do. Click the buttons, share, like, comment, and keep the conversation going. Join us next Monday to help you keep your practice game tight. Until then, keep it cute, keep it ethical, and take care of your patients.
Bye,
Bye.
y'all.